Hi, I'm Dr. Avi Gurwitz. I am the medical director of the Pediatric Urgent Care Center, and I'd like to talk to you today about pediatric head injuries. There is no medical test to diagnose concussion. The tests we use to diagnose concussions are questionnaires, and they're questionnaires based on the symptoms that your child may have. And there's as many as 30 different symptoms that you can have as a concussion, and I'll go through some of the more common ones. Headache, light bothering the eyes, nausea, some vomiting, fatigue, feeling emotional, either sad or anxious, trouble falling asleep, sleeping too much, dizziness, weakness, feeling out of sorts, saying they don't feel right. And each child will have one or two or many more, and that determines the severity of the concussion. The treatment for concussion is brain rest. Today's day and age, that's fairly hard to do. There's a lot of stimulus out there, TV, texting, and what you think is resting, such as sitting on the couch and watching TV, is actually not a lot of brain rest. There's a lot of sounds and sights. True brain rest means no TV, no homework, no school, and depending on the severity, it might even be for a couple of days to a week. The reason for that is, as soon as you start stressing the brain beyond its rest, the symptoms will come back, and the concussion will prolong itself. And so it is of utmost importance to get as much rest as possible early on. So any child that gets a head injury, the question always becomes, does he have a concussion? How do I know he has a concussion? And the answer is, ask the child. If the child says, I feel absolutely fine, they don't have a concussion. If they have any symptoms that persist beyond the first couple of hours, certainly symptoms that get worse over time because they're stressing themselves or being active, they probably have a concussion. To what degree? The only way to really know is to see a medical professional to then submit the questionnaire and understand how many symptoms and so to see how severe the concussion is. But for the most part, the treatment's the same, mild or severe. It's rest. The question is just how long. So while concussions aren't dangerous in and of themselves, there's one caveat. We always say no sports during concussions. And why do we say that? There's a phenomenon known as second hit syndrome. And this is very important. If you get a second concussion before you have fully recovered from your first concussion, you can have a devastating brain injury. And that's why you're absolutely not to have any possible contact sports or activities that can predispose you to getting a second concussion. A common question for parents is, my child fell, they hit their head. They're not acting quite right. Is it just a concussion or is it something more serious? And when I say serious, I'm talking about a brain bleed. And there are certain symptoms that are always a red flag, require immediate medical attention, okay? And those would be, if your child's lethargic, seizures, persistent vomiting, headache that is rated as the worst headache in their entire life, that's getting worse, double vision, inability to move the eyes or the arms on one side of the body. Any of those are immediate red flag and must seek immediate medical attention in an emergency room. There are certain segments of the population that will always require medical attention, and that is specifically non-ambulating children. And the reason for that is non-ambulating children do not have the protective reflex to put their hands out. And so when they fall, they'll usually fall on their head. And we're talking about infants and babies. And their heads are proportionally much larger than their body, so that's the part that's going to hit the ground first. They also have sutures, in other words, their skulls aren't fully formed, and so their brain is much more vulnerable to damage. So all children that are non-ambulatory, usually under 9 months of age, that have a fall, certainly that have a hematoma or a goose egg or a bruise on them, have to be evaluated by a medical professional. The bottom line when it comes to head injuries is the decision to seek medical attention comes down to one simple question that will almost always never fail you. Is my child acting right? If you cannot say that with 100% certainty, seek medical attention.